Hi everybody, it's Dr. Deb Muth. So today I want to tell my story of pelvic organ prolapse and how that's occurred and what that is. So when I was 28 years old, I had just had my last child, and remember maybe about a year after I had my last child, started to develop some pelvic pain, some discomfort, a lot of pulling, a lot of pressure, a lot of pain with intercourse, to the point where I just wasn't interested anymore in that because it was so uncomfortable for days afterwards. And one day I went to the bathroom and all of a sudden realized my cervix was misplaced. It was not where it was supposed to be. It was at the opening of the vagina, and I was a little startled, thinking, what the heck is going on here? I'm too young for anything like this. I know what this is because I was already a practicing women's health nurse practitioner, but was kind of alarmed that it was happening to me. So I immediately reached out to some of my colleagues to ask for a referral to see someone, and they recommended that I see somebody called a urogynecologist, which is a gynecologist who specializes in urogenital problems, so pelvic organ prolapse, urinary incontinence, fecal incontinence, that kind of thing. And I chose to see Dr. Catherine Stevenson out of Milwaukee, and worked with her for a while, and she did confirm that I had a pelvic organ prolapse. And initially we thought maybe it was just due to my rapid births. I birthed very hard and very rapidly, and so we thought, well, maybe that's just what's going on. And so we tried to do some physical therapy. I worked with something called a pessary for a while. A pessary is kind of like a diaphragm that gets inserted into the vagina and just pushes everything back up and holds it in place where it should be. And after about a year of working with that, I decided that this just really isn't for me with my active lifestyle as young as I was, and it really didn't resolve my painful issues around intercourse. So I opted to have a hysterectomy at, I think I was about 30, 29 or 30, somewhere around there. And that took care of my problem for a very long time. Fast forward to age 48, and I began to have similar problems. But this time I started having some urinary incontinence issues. And I started having some bladder leakage. I'd stand up, and right after I had gone to the bathroom, I'd be leaking urine down my leg again. I'd cough or sneeze and I'd leak, which is pretty common for those of us who've had children. And I dealt with it, but I am happy to say I am done with the poise pads. I am done with the panty liners, and I opted to have surgery to repair a cystocele, rectocele, and an enterocele. So a cystocele is simply something where the bladder starts to fall. A rectocele is where the rectum starts to pouch in and fall. And an enterocele is where the small intestine starts to fall. So needless to say, my whole pelvic cavity was falling. And I just got really tired of it. And I could have opted to use a pessary again, but having done that once, I just wasn't interested in doing that again. So I reached out again to Dr. Catherine Stevenson, who I absolutely love, and I was so grateful that she could still be my urogynecologist. And we opted to do a major procedure, not invasive, but somewhat major. It was outpatient, so it's not a big deal, but does take a longer recovery. And so that is why I have had to be off of work for the last month. We agreed on a month. I should have been out 8 to 12 weeks. We agreed on 4 weeks because I just can't let grass grow under my feet, you guys. I just miss being in the office and need to be working, but really felt like I needed to take some time to care for myself as well. And I'm super pleased with the results that I had, and I'm really proud of the recovery process that I've made. And I've read a lot of forums and interacted on a lot of forums with people about where they're at 4 weeks out from this type of surgery. And most people, I can say, are not nearly any place where I am, but I believe that that's because I did a lot of alternative treatments along the way to heal myself faster. Part of the problem with my prolapse is that I have a collagen deficiency, and because I have a collagen deficiency, that led to more problems with the prolapse. So I've implemented some things into my supplement routine to help assist with that and make sure that I don't have this problem again. When I can, I'm going to implement some PiYo. I was doing that prior to surgery, and it did amazing things for me. It's a mixture between Pilates and yoga, and I think that really helped to strengthen my pelvic floor. And I am just going to be real diligent and be real cautious with myself for a while here to make sure that I heal properly. So that is what's been going on with me. I'm happy to be able to share this story. I want women to understand that this is not something that we have to hide from or talk in secret about. This is something we really should be talking about in the public sector. We should be talking about this openly and honestly so that women understand that they're not alone and there are treatment options available for them. I am going to do another video on exactly what I've been doing the last 4 weeks to heal and recover. So if you're interested in what I've been doing, keep a lookout. You'll see my next video that'll tell you exactly what I've been doing these last 4 weeks to heal so rapidly. But I am super excited to be back in the office. Feel free to share this video with anybody that you feel could benefit from it. I'd really like the word to get out about pelvic organ prolapse. My good friend Sherry Palm created the apops.org. It's a nonprofit organization for pelvic organ prolapse. There's a lot of great information there, a lot of explanation, a women's forum that's private that you can chat with other women that are going through the same thing that you're going through. You can chat with some urogynecologists. It is a nonprofit organization that is nationwide. She's done a lot of work in Africa and other countries and lots in the US. And so if you're in the same boat that I am in and you need to have some information on this, please, go to her website. It's apops.org. Check them out. They'll be a great resource for you. I'm happy to chat with you if you want to chat with me about what you're going through, and I can share with you and make some recommendations and some referrals to some docs. But Sherry also has a great group of urogynecologists all around the country that she can help connect you with as well. Give you some leads and some questions of what to ask when you're looking for a urogynecologist, and some questions to ask yourself about when and if you're ready for a surgical option, or are there other options that you can take prior to surgery. So I am super glad, like I said, to be seeing everybody again, and I hope this clears up any myths about what's wrong with me, and I hope it helps some of the other women that are suffering from the same problem that I am. Thanks, you guys. I hope everybody has an awesome day. Make it the day of your life. Bye-bye.